everybody, welcome to Nursing Coaches channel. Today we are going to discuss about arthritis. Can see this? Arthritis. So what is meant by this arthritis? Arthritis means it is a condition which involves inflammation or degeneration that affects the joints. So what is this arthritis? Nothing but there may be any inflammation because of any injury or infection, or either it can be degeneration. Degeneration means nothing but there will be breakdown of the cartilage of the bones which is affecting the joints. So what is the main thing here? The joint is getting affected in the arthritis. So what is this joint? So next we'll see the joint structure. So here you can see the picture. So here I have drawn this. These are the two bones and this is the joint area. So here you can see this blue part. This is known as articular cartilage, and this surrounding black line is a synovial membrane. So what is the content of the synovial membrane? This cavity here, it contains synovial fluid. So this synovial fluid, it is preventing the friction of the two bones. And you can see this upper part, it is an articular capsule. So these are the parts of this joint. Clear? So what happens in this condition? So here I said that there is a cavity and which is protecting the friction of the two bones. So because of this arthritis, because of any inflammation or any degeneration, what happens here? It reduces the joint space. So what happens here? Here you can see this. See. So these are the two bones. So here we are having some space, joint space, which is helpful for joint movement and functioning. So because of this arthritis, there may be inflammation process or any degeneration. So they get closer. Two bones get closer. And you can see this attaching of two bones. So what happens? Because of attaching two bones, it leads to disability of the joint. So that is the arthritis. Clear? So this is the arthritis. Nothing but the joint is getting closer and it is leading to disability of the joint. Next, so what are the joints affected by this arthritis? Like hands, feet, hip, knees, lower back. These are the common areas. Incidence of arthritis, that is 22 to 39% in India were affected with this arthritis. That is roughly more than 180 million people were affected by this arthritis. And next, what are the types of arthritis? There are four types of arthritis were there. First one is osteoarthritis, second inflammatory arthritis, third juvenile arthritis, and fourth septic arthritis. So we'll discuss one by one. What are these types of arthritis? The first one is osteoarthritis. Osteoarthritis means nothing but it is a degenerative joint disease. Okay, so here this may lead to disability of the bones also. Sorry, joints. So this is the osteoarthritis. And second one is inflammatory arthritis. So what is the first type of inflammatory arthritis? Rheumatoid arthritis. So it is an autoimmune disease, or you can say it as inflammatory disease. So what is happening here? It is attacking the immune system. So this is the rheumatoid arthritis. And second one, that is ankylosing spondylitis. So here the arthritis is seen in the spine, that is especially lower back. So what happens there? There is a fusion of vertebrae takes place. So that is the ankylosing spondylitis. And next one, gout arthritis. Gout arthritis means here in this disease it causes hard crystals of uric acid in the joint space. So this is a gout arthritis. So what's happening here? Here you can see. So in the joint synovial cavity, here you can see the deposition of this uric acid. So which is disturbing the joint function. So that is the gout arthritis. Nothing but there is a hard crystals of uric acid in the joint. So that is gout arthritis. These are the three types of inflammatory arthritis. And what's the third one? Juvenile arthritis. So in this arthritis, it is seen in the children. So especially 16 and younger group were often suffered with this juvenile arthritis. So it is attacking the immune system. And fourth one. So fourth one is septic arthritis. Septic arthritis means nothing but there is infection in the synovial joint. So due to maybe any trauma, that is injury or any animal bite, when there is any animal bite, directly the germs enters into the joints. So this is leading to septic arthritis. So what will be the symptoms here? They'll have fever, joint pain and swelling. This is the septic arthritis. Next we'll discuss the risk factors of arthritis. So what are the risk factors? First one is like genetics. So because of any family history, they may get this arthritis. And second one is obesity. Because of overweight, there is overstrain over the joints. So they may cause this arthritis. And next, because of infections, it may be viral infection or bacterial infections or fungal infections. This is also one risk factor. And next, immune system dysfunction because of any autoimmune diseases and because of any injuries. So for example, for any sports player, they may experience injuries. So this may also lead to arthritis. And next, gender. So coming to gender, they have given the differentiation according to types. So what they are saying that for women, more commonly they are affected for rheumatoid arthritis. And coming to this, men, they are more prone to get other type of arthritis. So maybe ankylosing spondylitis or gout or others. Okay, this is the gender differentiation risk factors. So what they are saying, women were more prone to get rheumatoid arthritis and men, they are more prone to get other type of arthritis. And next, lack of exercise. Because of lack of exercise to the body, they may experience this arthritis. These are the risk factors of arthritis. And next, what are the symptoms you can see in the arthritis person? First thing is you can see this pain. So in this arthritis patients, they feel constant pain and they'll suffer with swellings. You can see the redness, swelling, tenderness and crepitation. Crepitation means nothing but you can hear the crackle sound in the joints. So that is the thing you can observe. That is the crepitation. Okay, next is stiffness. You can see the stiffness in the joints. And there are two other deformities observed in the persons. That is Haberdan's nodes. Here, that is nothing but in the interphalangeal joints. So in the distal interphalangeal joints, you can see the deformity. That is said to be Haberdan's nodes. And second one is Bouchard's nodes. Here in the proximal interphalangeal joints, you can see the deformity. That is a disability you can observe. And also you can see other symptoms like fever, chills, fatigue, loss of appetite, etc. These are the symptoms of arthritis. And next, we'll discuss pathophysiology. Pathophysiology of arthritis. So, due to risk factors like injury, infections or obesity, lack of exercise, etc. Because of any risk factor, what's happening? It is leading to progressive loss of cartilage. So, when there is progressive loss of cartilage, it takes place remodeling of the bone. So when there is remodeling of bone takes place, it is leading to active response of chondrocytes. So when there is active response of chondrocytes, it releases the enzymes. So when there is release of enzymes, it breaks down the collagen and proteoglycans. So when there is breakdown of this collagen and proteoglycans, it leads to destruction of articular cartilage. So this is the blue part. This is the articular cartilage. It gets destroyed. And when there is destruction of this articular cartilage, it is leading to osteophytes. Osteophyte means nothing but bone spur. You can say it as spur, bone spur. Okay, so there is a growth of bone. which is leading to the disability of joint. Right? This is the pathophysiology of arthritis. What is happening here? Because of any risk factors, it is leading to loss of cartilage and remodeling of bone takes place, and it is leading to active response of chondrites. This chondrites release the enzymes and it is breaking down the collagen and proteoglycans, and it makes the destruction of articular cartilage, and it leads to osteophytes, that is a growth of bone takes place, and it is leading to disability. This is the general pathophysiology of the arthritis, and it differs for the types of arthritis like rheumatoid arthritis and gout. It is differing. So this is only the general pathophysiology. The diagnostic findings of arthritis are X-ray, CT scan, MRI, blood culture, ultrasound, uric acid test, synovial fluid culture, and examination. So we'll discuss in detail what are the parts visualized by this type of diagnostic findings. The first one is X-ray. Through X-ray, it visualizes the bone, and also it shows the cartilage, bone damage, and also bone spurs. And this X-ray, it is not revealing the early state of arthritis, but this X-ray, it is useful to find out the progression of disease. This is about X-ray. And coming to CT scan, here it visualizes the bone as well as the surrounding soft tissues. So this is the CT scan done with the help of X-ray only. They will take the cross-sectional images to find out the surrounding soft tissues. And next is MRI. So here it visualizes the soft tissues, and here you can see this tendons and ligaments clearly. And next is blood culture. So here, like you are doing this ESR and CRP, C-reactive protein. So these two levels are elevated when you go for this blood culture. So when there is elevation of this ESR and CRP, it indicates that there is an inflammatory process in the body. Okay, so that is the blood culture usage. And next, ultrasound. So in this ultrasound, it is helpful to find out the synovial fluid. So here you can find out the synovial fluid containing the joints. So it is helpful to find out what is the thing happening in this synovial fluid, which is either it may be breakdown or any inflammation. You can find out in this ultrasound. And next one is uric acid test. So uric acid test itself, it indicates the type of, it is useful to find out the gout arthritis. So when you go to this, when there is high levels of uric acid, it is helpful to find out the gout arthritis. And next is synovial fluid culture and examination. So when you take this for examination, the synovial fluid, it is helpful to find out the presence of organisms. Okay, the presence of organisms is able to find out through this synovial fluid culture and examination. Management of arthritis. There is no cure for arthritis, but only will give the medical management, that is relieving the symptoms. So what is the first symptom? Pain. So we are giving administrating some painkillers like acetaminophen is given to relieve the pain. And if there is any severe pain, we are also administering opioids like tramadol and oxycodone. These two opioids are also given to relieve the severe pain in the patients. And next type is we are giving NSAIDs, non-steroidal anti-inflammatory drugs are also given. So like ibuprofen is given, and also naproxen were also administered. The main function of this NSAIDs is it reduces the pain as well as the inflammation. So this is the NSAIDs role. And next we are giving for especially this rheumatoid patients, rheumatoid arthritis patients, we are administering this DMARDs, means nothing but disease modifying anti-rheumatic drugs. So what are those drugs? Like methotrexate is given, or otherwise hydrochloroquine is suggested for the patients, especially for this rheumatoid patients. And next, for the case of septic arthritis, we are giving antibiotics. And if there is any infection because of fungal, then we are giving antifungal drugs. And also we are going for this intra-articular injections also. Therapeutic injections are also suggested for the patient. So we are taking this corticosteroids. So like cortisone as well as prednisone. These may be indicated for the patient, which helps in the movement of joint. So this is the classification we are giving for the arthritis patients medical management. The surgical management of arthritis. So the main two functions is joint function and as well as for joint movement, we are going for this surgical management. So what are those? First one is arthroplasty. Arthroplasty means nothing but joint replacement. So here we'll replace the damaged joint with the artificial joint. So that is the arthroplasty. And second one, this is arthrodesis. Arthrodesis means nothing but joint fusion. So here what we'll do, we'll see this joints, damaged joints is removed and we are fusing these two bones and they are locking with the fusion and making this into a rigid unit. So nothing but in this arthrodesis means nothing but we are removing the damaged joint and we are fusing the joint to make it rigid unit. That is the arthrodesis. These are the two surgical procedures done for the arthritis. And next thing is nursing management. So coming to nursing management, first thing we have to see the signs and symptoms. You have to assess the signs and symptoms. So based on their signs and symptoms, we are giving the care. So what is the first thing? They may be having the pain, swelling. So you have to go for any heat and cold applications. You can provide them any heating pads or ice packs to reduce their pain and swelling. And next, pharmacological therapy. Nothing but administering the medications given by the physician. So timely you have to explain and you have to make them to use the drugs timely and correctly. And next thing is physical therapy. You have to encourage them to go for exercises, yoga, okay, and also especially this water aerobics, and you have to encourage them to go for swimming. So these aerobics, they help to reduce the stress over the joints. So you have to educate them, and also you have to educate them to about the weight loss. So obesity patients, so you have to encourage them to control their weight by doing all these exercises and also controlling their diet. And next, rest painful joint until it gets better. This is the main thing you have to focus. So how we have to rest the painful joint? By using any assisting devices. What are the assisting devices we are giving for the patient? Like any walker, splint, braces, supporters, etc. We are giving the patient to support the joint and making the movement easy. Okay. So you have to educate them how to use these devices. This is the main role of nursing management you have to do. And the next thing is dietary management. So the dietary management is we are educating them to take well balanced diet and they have to cut out this extra calories and they have to take more fruits and vegetables. Okay, so when they take this more fruits and vegetables, they protect the cells from damage. And next we have to educate them to take this omega-3 fatty acids. Okay, and this omega-3 fatty acids, they decrease the morning stiffness in the patients. So many patients, they suffer to wake up in the early morning and to set also. So if they take this omega-3 fatty acids, it reduces their stiffness. And next, use of olive oil. This olive oil, it prevents the inflammation. So we have to educate them to use this olive oil. And also intake of vitamin C. So this vitamin C, it is helpful for joint health. And also it produces collagen. Okay, so it is useful for the healthy articular cartilage. So this is the dietary management we are giving for the arthritis patient. And next thing is complications. So what are the complications? So you can see like chondrolysis means nothing but rapid breakdown of the cartilage. And next, osteonecrosis, that is nothing but bone death. Next, you can see bleeding inside the joint. Next, infection in joint. Next, disability, loss of disability. These are some complications of arthritis. You can see this chondrolysis, that is rapid breakdown of cartilage takes place, and osteonecrosis, bone death. Next they may see bleeding inside the joint, and next infection in the joints, and also loss of disability. These are the complications seen in the arthritis. So what is the prevention? You can say to the clients like stay active. Next, rich in calcium foods. So for preventing this, you can say them to maintain healthy weight, stay active, rest, and next, take plenty of fluids, and healthy diet. Okay, these are the prevention you can do to prevent this arthritis. So if any person suffering from arthritis in your families, means first of all you have to take care of your weight. You have to maintain your weight, and you have to eat healthy diet, and also you have to stay active, and you have to do all the exercises, walking, yoga, meditations, and everything. You have to focus, and you have to take sufficient rest, and you have to take plenty fluids. This is the only thing you can prevent this arthritis. I hope you understand this topic, arthritis, and please like and subscribe the channel. Thank you.